How are you doing?
Good.
It went beautiful. He has atrial fibrillation and he could not tolerate any blood thinner. He tried 3 of the DOACs. He tried aspirin, Plavix, and he would bleed with everything. And I actually tried to consider him for a procedure called a lariat, and even that was not effective. We couldn't do it. So we had no option. So what I did is I gave him low-dose Coumadin, and he could tolerate low-dose Coumadin for some time. So I told him as soon as this new device is available, potentially you will be the first patients. And his wife was absolutely desperate. So when I called her last week and said, this is an option for, she was thrilled. She said, I'll be the first patient.
Oh, sure.
You're one of the first people in the US to get this device. Congratulations.
Thank you.
And you agree, Andre, that stroke is probably the most devastating complication of atrial fibrillation.
Yes.
And there is a way to treat these patients or prevent strokes, and the standard way is giving blood thinners. However, there are some people who cannot take blood thinners, either because of their occupation or of compliance or actually bleeding. And as a result of that, there has to be an alternative. Now, there's a part of the heart called the atrial appendage, which is like a little pouch. And in atrial fibrillation, blood pools in that little appendage, and clots can form there, and these clots can come out of the appendage and lead to a stroke. This is a method of actually closing up that little pouch with a little umbrella-like device. The procedure is done just through the groin without open heart surgery, and as you saw today, it took us less than an hour to do the procedure. There was an amazing degree of safety with this generation comparison to the previous generation, right? Also, the efficacy, there was actually better efficacy because when you close the appendage, you want to make sure that there's no leak around the atrial appendage, right? And in this, with this device, if you compare it to the previous one, there's a slightly better seal with this device. So the characteristics of this device is slightly more safer, it's easier to use, and probably causes a better efficacy anatomically. Question, you took all these blood thinners and you could not tolerate any of them, right?
Right.
Everyone you bled with.
Yes.
You bled with, you took Davigat, you took Pradaxa, you took Aliquist, you took Xarelto, you took aspirin.
Aspirin was the worst.
When I rode my horses, I would get tired real easy, and hopefully that would go away. It's a little hard when you work 10 minutes and you have to sit down.
When you actually look at these patients over 5 years, there was actually a mortality benefit over people who actually took Coumadin long term. And also there was less disabling strokes. And third, there was definitely less bleeding, especially catastrophic bleeding. So I think for these 3 reasons, this is actually a long-term solution for patients. This device is appropriate for those who should not, who will not, and who cannot take long-term anticoagulation. You want to go home tonight?
I'm ready.
You're ready? That's it. You look great. Yeah, a few hours after you're going to sit up, and then you have to stand on one leg and do a jumping jack. And if you can do that, then you're out of this place.
Did I go home? Okay.
Yeah.
Okay.
All right.
All right.